Welcome to Decoding Healthcare Research, a podcast by Agora Project. Join us as we delve into the behind-the-scenes world of groundbreaking research and the dynamic healthcare industry, interviewing top paper authors, engaging experts on industry-related topics, and exploring medical subjects that affect our daily lives. And now, your host, Dr. E.F. Rain.
Welcome to Decoding Healthcare Research. I'm your host, Efrain Riveros, Dr. E.F. Rain. Today, we will be talking about insulin resistance. We are going to talk about an interesting biochemical pathway that involves also the growth hormone and how this is important for health and how it is related to what we call the Westernization of the diet and the lifestyle that we have adopted on the Western world that is having significant impact on our health. So to discuss this, we are here with Dr. Janssen. Dr. Joseph Janssen is an expert and probably one of the world leaders doing research about this particular topic. So Dr. Joseph Janssen is an associate professor of the Department of Internal Medicine, Division of Endocrinology at Erasmus Medical Center in Rotterdam, the Netherlands. So welcome, Dr. Janssen.
So you're also welcome, and thank you for these kind words. I hope you will enjoy it.
Yeah, absolutely, absolutely. So we are going to base our discussion on two papers that Dr. Janssen published. Both of them are published in the International Journal of Medical Sciences, one of them in 2021, the other one in 2023. So the titles of the papers are related. One of them is Hyperinsulinemia and its pivotal role in aging, obesity, type 2 diabetes, cardiovascular disease, and cancer. And the second one is titled The Impact of Westernization of the Insulin IGF-I Signaling Pathway and the Metabolic Syndrome. Is it time to change? So before we start, I want you, Dr. Janssen, to give us a little bit of background about your research. What have you been doing and what is your contribution to this interesting theme?
I've worked from 1993. Consequently, especially in the first place, worked on growth hormone, insulin-like growth factor 1 activity. I have studied on that, on growth hormone deficiency, on acromegaly, and especially have also have been involved in developing IGF-I bioassays and insulin receptor bioassays and to get better information about the whole system. And the last years, I have even also more focused on the importance of insulin and insulin resistance in all sorts of diseases. That's already, of course, done for many years, but I think that is very interesting. A change in the way of thinking, because always people were focused on this insulin resistance as starting point, and probably that is, in my opinion, not totally correct. You should probably start earlier, and you should think that hyperinsulinemia is the main factor involved in inducing insulin resistance in many cases. Not all, I will say. There's still people who have some genetic induced insulin resistance, and also insulin sensitivity, receptor sensitivity is genetically induced, but you have individual differences. But the fact that the last 6 years there is so enormous amount of obesity and type 2 diabetes that cannot only due to genetic background, because our genes have not so quickly changed the last 6 years.
That's absolutely true, and you mentioned that in your paper that the metabolic syndrome and all these ramifications, including diabetes mellitus and probably other disease processes, they have hyperglycemia and insulin at the very center. And even though the genes have not changed, because the evolution-wise, it's impossible for us to adapt so quickly, everything has to do with lifestyle, or the majority of it.
At least a lifestyle above a certain genetic background, because if you have a certain genetic
predisposition,
predisposition,
Yeah.
then you will have earlier this sort of problems.
Yeah, that's absolutely true. And I think, and I want to focus a little bit on the role of hyperinsulinemia. But before we go into that, let's talk about physiology a little bit. So you have been doing a lot of research about the axis that involves insulin, insulin growth factor 1 or IGF-1 and growth hormone. Can
Yes.
you illustrate a little bit more about how this axis works and how is it related to health and disease?
Normally, you need a well-functioning growth hormone IGF-1 axis, but you should never look to the growth hormone IGF-1 axis independent from insulin, because insulin plays also an important role in the regulation of a good action of the growth hormone IGF-1 axis, because you need insulin to have enough growth hormone sensitivity, but also to make IGF-1, and also for a good negative feedback from IGF to growth hormone. If that is not there, then you will get enormous problems. And I have, of course, treated many adult patients with growth hormone who had developed of acquired a growth hormone deficiency during their adult life, due to, in most cases, due to pituitary tumors. And then I have started, I've treated them with growth hormone, and then I have also learned how important it is that you should search the balance, but also try to normalize the balance, which was probably there before they developed growth hormone deficiency.
Yeah, and you mentioned in your paper, and this is, I think, central here, that IGF-1 creates a negative feedback loop for both insulin and growth hormone.
Of course, and that is this and there's both growth hormone and insulin can stimulate IGF, and in turn, the IGF-1 will also have negative feedback, both not only on the growth hormone secretion, what everybody probably knows, but also it influences also the insulin activity at the insulin receptor. Dus it's a very complex system, and it's probably developed during evolution, because it is very important to regulate all your metabolic substrates in a good way. Otherwise, you will not survive.
Yeah, and I see that exactly, that there is a balance, a very fine balance between insulin and growth hormone that is mediated by IGF-1. So let's focus on insulin. So in conditions of hyperinsulinemia that actually has been associated with multiple disease processes, this hyperinsulinemia has traditionally been attributed as a secondary event after you develop insulin resistance. But you argue that it may be actually the other way around, that that the hyperinsulinemia is the one that causes insulin resistance.
Yeah, and that is probably the starting point, and what was probably not always realized, that overnutrition and especially high calorie intake, but also certain foods are probably very strong in stimulating the insulin secretion. But you should realize that in clinical practice, as I have been more than 38 years internist, we only measure insulin levels in blood when we are looking to patients who have developed hypoglycemia, and not in the normal and epidemiologic studies. There's also look to insulin levels, but they taken often one sample of blood, and that is a weak point in all these sort of things. Yeah.
Yeah, so and this is a true paradigm shift, because if we think of hyperinsulinemia as the primary problem, probably the therapeutic interventions should focus on restoring the balance between insulin and growth hormone, and that's actually a huge contribution to the understanding of what is going on with metabolic syndrome and diabetes mellitus. I want to move on and talk about what now we say that hyperinsulinemia is important. So what is the definition of hyperinsulinemia? That's the first question. And the second question is, we know that insulin is not constantly produced, but is produced by pulses. So please tell us a little bit more.
I will further comment on that. First of all, what is hyperinsulinemia? That is very difficult to define, because we have, of course, no good, clear definition. And most people will, especially in epidemiologic studies, use the people who have the above the 90 percentile or above the 75 percentile of the total population are arbitrarily defined as people with hyperinsulinemia. But that is, of course, that is not physiology, because normally you have a continuously level, and one of the difficulties is that you should the insulin is secreted in a pulsatile manner, and if you take only one blood sample at one point, then you can have in a peak of the insulin, you can be in the true of the insulin level, and you can between. And dus to have a good estimation of the actual insulin levels, you should at least take in 3 samples within 5 minutes to get a better picture what is really the insulin secretion at that moment. But that is in practice never done, at least not in epidemiologic studies, but also not in clinical practice. That is very unusual. Another point is then, how do you measure insulin? You use insulin immunoassays in most cases. Maybe that will change in the future, but at the moment, immunoassays are the leading method to measure insulin in the blood. And that has also a weak point, because there is no international standard for insulin. Thus, all labs measure their own insulin levels. You cannot compare that between lab A and lab B. They can't have the same sample. They will produce probably a total different outcome. This is enormous noise in the measurement. What's also important, I will show you some slides of that, if it is possible.
Yes. Yeah, you can share the screen.
If you see, normally, if you look to the healthy subjects, do you see now the
yes.
slide? There's a healthy subjects, insulin secretion into the circulation is accounts about for the pulsatility accounts for about 75% of the insulin secretion during the day. Here, and insulin is also more effective biological if it is delivered in pulses than continuously. But if you look then to patients with impaired glucose tolerance who have developed type 2 diabetes, there is initially at least a lack of pulsatility, as you can see in the lower level compared to the control subjects. That is very important also for probably the biological action of insulin in all sorts of circumstances. Here it is far more continuously a certain level, while here it is going upwards, downwards. You see, there's far more informative. You see,
yes,
and that can make enormous difference in my opinion.
Yeah, definitely, and I think it's important to point that out, that the pulsatility of insulin production is something that probably needs to be addressed in research. And if we continue along the same lines of insulin concentration, most of the papers are focusing on an increase in the production of insulin.
Of course.
But the clearance is also important.
Yeah,
so
you can also develop hyperinsulinemia not because you have increased insulin secretion by the pancreas, but because the liver does less cleared insulin in the first pass, and then you get peripheral, at least after the liver, at the muscle level and at the fat cell level, you get higher insulin levels. So that can be also a cause of hyperinsulinemia. And it is, of course, at the moment, not easy to find out in an individual what was the reason of the hyperinsulinemia. Was that decreased hepatic insulin clearance? Was it increased insulin production by the pancreas, or both?
Yeah, and I think it's important to show that. Actually, it's very interesting that you mentioned in the paper that the population of African American patients with obesity actually show a decrease in clearance of insulin, probably related to a mutation. So that opens a new window for understanding the pathophysiology of metabolic syndrome and diabetes mellitus. So I want to talk about something related, and it's you mentioned that the changes in lifestyle, specifically the Westernization of the diet, has a significant impact on the balance between insulin and growth hormone. And you use as an example a population of immigrants from a place in India who moved to the UK, so that you could make the comparisons. Can you tell us a little bit more about that?
I will show you this with some slides, if you like, and it's what is a very interesting study which has been done by Adrian Heldvies from Manchester. He has more than 10 years ago done a very nice study. I will show you within some moments the slides. He has what they have done. They have compared people who were living in India and Gujarati, in Navsari, that's the place where they were living. They have compared with people which were originally also Gujarati. We were most of them family members, which have moved to central UK, and they have then compared them 30 years after these people have moved from India compared to the native population in Gujarati, and they are probably genetically comparable. And then they have assessed the food intake in these people. And what the interesting point is then that is the following: that the total energy consumption in the migrant in the stippled line was considerably higher. You see, there was moved to the right, and that was not the total energy consumption, but what also was moved to the right was the total protein intake. As you can see, it's very impressive. And at the same time, you see also the fat intake, the total fat intake was probably was also considerably and significantly increased. And if you then look to the patients, there's only focus for men, but you can also see this for women, although it was for women less significant. Then you see these have comparable age and height, although the height is a little bit higher in the people from UK. But what most interesting is the BMI has been changed from 21 to 25.9. There's more than 4 points higher in 30 years compared to what it is. And that has also effects on the waist-hip ratio. It's increased. The systolic and diastolic burden has increased. And here you see there is a difference in about almost 1,000 kilocalorie per day intake. And that has also important effects, not only on the insulin sensitivity. The insulin sensitivity has decreased in the people from UK, here in the HOMA S percentage. And the hyperinsulinemia is more developed in the people from the UK as a consequence. But that's probably just the intake. This have probably initially induced this hyperinsulinemia. And if you look then to the IGF in this population, then you see that has also moved to the right. Dus the change in the food intake and the number of calories has influenced the absolute amount of total IGF you can measure in the population. And that is probably one of the largest problems in many countries in the world, especially in these countries which have tried to overtake Western lifestyle. Okay.
Yeah, I think this is very compelling evidence that definitely the change in lifestyle, particularly diet, is associated with hyperinsulinemia and the effects that it has. So let's talk about those effects on health. So it's clear that if you continue westernizing your lifestyle, you are on your pathway, depending, as you said, on genetic predisposition, on your pathway to develop metabolic syndrome and all these diseases. But it's not only that, it has effect on other systemic diseases as it is related to inflammation probably. But one of the concerns for the majority of people is longevity. Yes. So let's talk about the effect of or the role of IGF-1 and insulin on longevity.
Yes, I will also talk. There are many animal models which already suggest for many years that if you have less activity of the GH-IGF-1 axis and less insulin activity, that influences you longevity, it increases your longevity. And this shows us also that at least as you have centenarians in the human situation, they have often a very good insulin sensitivity and very low insulin levels. And that suggests at least that in this way you can survive longer. And that's probably due to the fact that these people have less oxidative damage, due that they have less food which can induce that. They have a less proliferation due to the lower insulin and IGF-1 axis activity. And that will, on the long term, probably result in a better, of a longer life, at least as long as these people are not harmed by an accident, by traffic or something like that. But that can still occur. Also, if you have this such advantage, and you should also, of course, have not epidemics with all sorts of viral infections. But because, of course, that can also influence. But probably these people have also are more protected to survive during these situations than people who have not such background.
Yeah, and I see that it's very clear, the evidence backing the effect of the signaling pathway for insulin and IGF-1, and one of the examples that illustrates this signaling pathway and its effects is something that you mentioned in your paper, and is the Laron syndrome. Yes. There is a mutation on the receptor of growth hormone that makes IGF-1 insensitive. Yeah. So can you expand a little bit more?
Yeah, of course, the subjects with Laron syndrome, the number is very small in the world, but there are some cohorts in Israel, but also in Ecuador. And in Ecuador, they have looked to about more than 140 people with Laron, and they have compared the life expectancy with the family members who did not have this genetic background. And what you see is that they develop less diabetes, they develop less cancer, Although in this Laron dwarfs, they don't see an enormous more longer life expectancy compared to the family members. So but there's really a shift in the risk for cancer and for cardiovascular disease, not because, but especially for cancer and for diabetes, that is there, and that is an important point. Yeah.
So it's like a natural experiment, and that's interesting. So we have been talking about the physiology, the pathophysiology, when an imbalance between the two, growth hormone and insulin, happens. But let's talk about the good news. You can restore your normal function by going back to the hunter-gatherer lifestyle. So if we decide to move away from the Western diet, so what would be the changes, and how long do you think it would take for it to be restored?
That is something what can happen very quickly. You have, of course, very recently all this work of Professor Taylor from he's from Newcastle, I think so. He has done this for type 2 diabetics. He has given people doing 8 weeks a very low calorie diet, and he can then let disappear the fatty livers and also restore at least so improve the glucose tolerance such that these people no longer need oral anti-diabetics or insulin treatment to have normal glucose levels, and that remains with the help of exercise at least for 5-6 years, what is now at the moment the available data. That's only done in people with a relatively small group, 200 people, but it shows that exactly works. The same is, of course, that we know of, course, also from this bariatric surgery, that you can have very quickly improvement of your insulin levels and also from your glucose tolerance by losing weight, but probably the most important factor is that you get a relatively negative energy balance, which restores all the fatty depositions which have been occurred everywhere in the body due to the long-term overnutrition.
Yeah, and actually the fact that bariatric surgery leads to quick changes is in favor of the idea of hyperinsulinemia to being,
of course, because the insulin goes already down before the insulin resistance is totally normalized. So that shows that the exogenous nutritional factor is influencing these insulin levels far more than the actual insulin resistance. But of course, the hyperinsulinemia as such can also induce insulin resistance at the receptor and the post-receptor level, and that it takes time to restore from that if you normalize the insulin levels.
Yeah, and I think we have been able to walk through a continuum from physiology, pathophysiology, and explain very nicely how the metabolic pathways interact. But the more important thing here is probably that there is a solution to all this. If you change your lifestyle, the physiologic changes you see.
Of course, and that is a relatively not so expensive intervention. That is also very important, and you can probably use all over the world. It's probably not so difficult to start with as treating all people with very expensive drugs. That is probably not the way we should go.
Yeah, correct. And these changes in lifestyle are important not only from the individual perspective, but also from the public health perspective, because the improvement of health is going to have different ramifications. And for the healthcare systems, there is a burden in terms of pharmacological interventions that can be alleviated, right?
And important is also to start already at a very early stage in life with that. So we should not first let develop all these problems, and then we try to solve them. We should try to prevent them developing.
Yeah, by changing the lifestyles
Yeah.
and teach our kids to live a healthier life. That's definitely a great message to convey to our audience. So I think that way we can close by saying that this has been a very nice summary about these papers. And I enjoyed this conversation because the way you are approaching the problem is not only important, but is contributing in a different way. So the focusing on hyperinsulinemia is probably easier to intervene than focusing on the insulin resistance per se. So I want to thank you, Dr. Janssen, for this time, for sharing this information with us.
And you also, thank you very much for inviting me and giving the opportunity to discuss this problem, because it's very important.
Absolutely. Thank you so much. And for our audience, the links to the papers are going to be in the description. And remember, go ahead.
You can always email me. Maybe I can give my email address, not?
Perfect. Perfect. So we can share that. Perfect. That's perfect. So we can have that, and we will follow up on your research. And I hope in the future we can talk again to see the progress.
Okay. Thank you very much.
Thank you so much.
Yeah. Bye.
Thank you so much for tuning into this episode. If you enjoyed it, please don't forget to give us a thumbs up and share it with your friends and family. Make sure to subscribe to our channel and hit that notification bell so you never miss an episode. If you have any questions or thoughts about today's topic, we'd love to hear from you. Feel free to leave your comments down below. For more information and references related to today's discussion, you can find them in the video description below. We appreciate your support and look forward to having you back for our next episode.